Welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. My name is Brian Greer, and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is From Taboo to Essential, Unveiling and Addressing Period Poverty in the United States. Our guest is Dr. April Ballard, who is an assistant professor in the Department of Population Health Sciences in the School of Public Health. Dr. Ballard earned her PhD in Environmental Health Sciences from Emory University and her MPH in Environmental Health and Epidemiology from the University of Kentucky. During her PhD, she was a fellow in the Center for Global Safe Water and the Center for Excellence in Maternal and Child Health. In 2021, she was recognized as an Agents of Change and Environmental Justice Fellow. Her work is on health disparities and equity related to water, sanitation, and hygiene. She employs mixed methods approaches to understanding how social and environmental conditions influence behaviors, and health outcomes, specifically focusing on children, women and girls, and those experiencing homelessness. Dr. Ballard applies advanced statistical modeling, qualitative methods, measurement development, and theory-driven approaches to emphasize approaches. She emphasizes translating research for public health policy and practices in her work. She is particularly interested in developing and implementing human-centered, pragmatic programs to address inequities. She has worked in public health research for nearly a decade. She has led rural and urban-based projects in the United States, including Appalachian Kentucky, Central Kentucky, Metro Atlanta, and Ecuador. So today's webinar will be guided by 3 general questions. What are you doing? Why is it important? And how can we get involved? Quick note, if you have a question at any point during our conversation, please feel free to type it into the Q&A box and we will try our best to answer. So with that, I want to turn it over to Dr. Ballard. Can you tell us a little bit about your research? What are you doing and why is it so important?
Yeah, thanks so much, Brian, and thanks to everyone for being here today. I'm going to start by just telling you all a little bit about what period poverty is and what I'm currently doing related to this topic here in the United States. And I'll touch a bit on why it matters specifically as a public health issue. So period poverty is having insufficient access to products, education, facilities, healthcare, and anything else that is needed to effectively manage menstruation. And the image on the screen here is just showing examples of what people may use when they lack access to period products that they need to manage menstruation, which, as you can see in this definition, is just really one key aspect of effectively managing menstruation. Period poverty disproportionately impacts those who are low income, in part due to the high cost and taxation of period products in the United States. A study that was done in 2019 found that among people who menstruate who are low income, 2/3 of them actually reported having trouble affording products in the past year. And we see that, there are over 20 states that still actually tax period products across the US. This sales tax ranges from 4 to 7%. And mirrors that of decor, electronics, and makeup, which are obviously non-essential products, whereas actual period products are medically essential. In the state of Georgia, we have a sales tax of 4% actually on products. We have seen some movement in recent years where policies have tried to address this by either removing taxes or, for example, in Georgia, products are now deemed medically necessary. So if you have a HSA or an FSA account, so those tax-free health savings accounts, you're able to actually use that to purchase products. But there's still many barriers, even in existence, even with those policies in existence. We're seeing that policies generally, though, are becoming increasingly popular to address period poverty and promote equity. So here on the screen, I just have a screenshot from Inside Higher Ed that's just noting that legislative action is really kind of increasing as period poverty public awareness is increasing. We also saw in 2022 that Scotland became the first country in the world to make products free for everyone. And then In the UK, we've seen the elimination of taxes on period products. And in the US, we've also seen those kind of removal policies of taxes, but we're also targeting period products in schools for children, as well as homeless shelters, and also in public and government-owned buildings. Now, as I have mentioned, we're seeing a lot of policy in the US, and this is really at the city, state, and federal level. And so in 2021, Ann Arbor, Michigan actually became the first US city to require free products in public restrooms. We've seen other policies at the state level, such as requiring tampons and other products in homeless shelters. This is just an example from New Jersey, but we also have other policies that require products in schools, as well as in shelters and public spaces. And then just last year, we saw there was a proposed policy that would it was related to period poverty equity that failed at the national federal level. There hasn't been another policy introduced since that policy failed. But just noting that really this has become a very important and critical topic in the US, but also across the globe. Now, the adoption of these state policies are representing kind of a new public health intervention that we're seeing specifically for low-income children is the most common type of policy that we're seeing. And this is really where my work currently sits. So we see since 2017, which has only been 7 years, we've seen 30 different states pass policies that support the provision of free products in largely public schools. And these policies vary widely across states, each having kind of their own sets of implementation activities and programmatic requirements or lack thereof. So we have mandates, so that's where schools are required to provide products. So for example, California has a mandate. We have appropriations where funding is just allocated for schools to provide products. So in the state of Georgia, for example, we have an appropriations policy where money is provided each year to the Department of Education for schools to provide free products. And then we have authorizations, which are just policies that say, hey, you're allowed to provide products. And so states such as Florida have authorizations. The authorizations are newer policies, and they're just actually in the Southeast US. And there are some states that have kind of a combination of these policies where maybe certain schools are authorized but not required to provide products. Some schools are mandated, and then some schools or all schools are eligible to receive funding for this. So it looks very different across states. And this is, a public health topic because we have these seemingly intuitive community programs and policies that may fail to actually have the anticipated results that we want them to have, and may actually have unintended harms. So I think that we could all agree that the provision of free products is a good thing, but are we delivering them and implementing these policies in a way that are actually having the results we want them to? And so that's really where my work is sitting. So we need to know, decision makers as well as public health professionals need to know which policies are actually effective. There's not a lot of research on this currently. And we need to know how to implement those policies. But there has not been research done to actually rigorously and comprehensively evaluate these policies that are trying to provide products in public schools to address period poverty. And so I think, this question of why does period poverty matter as a public health issue is probably seemingly obvious, but just to really drive home the point and show that it is much more expansive than it even seems on the outside. So when people who menstruate are unable to actually manage their period, it can negatively affect the right to education, work, and health. So we see that people may miss school during their period if they don't have the necessary facilities or supplies. There can also be pain and discomfort, lack of education that can just make people feel like they can't go to school when they're on their period. We also have people who miss work for similar reasons, which obviously impacts their ability to remain employed, but also to bring in income. And then lastly, of course, the use of products that are improvised or not being able to actually change products regularly can lead to infection, which obviously has adverse health outcomes. If we have repeat infections, that can lead to even longer term or more adverse impacts, such as infertility and reduced reproductive health. And from kind of zooming out from a larger standpoint, we see that addressing period poverty is actually related to the Sustainable Development Goals, which were developed by the United Nations and are really a call to action to end poverty and inequality. So these really guide countries across the world and how they plan, prioritize, and invest. And so there are 17 Sustainable Development Goals that were created in 2015 that we're hoping to achieve by 2030, which is obviously coming up quite quickly. And none of them directly state anything about period poverty or menstrual health. However, many of them cannot be achieved without considering how we might address period poverty. And so just very briefly, we'll see that with Sustainable Development Goal number 3, without making sure that people have access to affordable products, we won't be able to ensure that population good health and well-being are achieved. Sustainable Development Goal 4 is about quality education, and without children having access to what they need to manage their period, we won't be able to achieve that goal. Gender equality, we see that there are many taboos, myths, and stigma related to menstruation that are portraying those that menstruate as inferior compared to those who don't. And so this is really at the crux of gender equality. And then, of course, clean water and sanitation is necessary for menstruation. And so without considering how period poverty and menstrual health play into this, we won't be able to effectively and meaningfully actually achieve that goal on a global scale. And so, menstrual health, I think, it is integral to population health. And we see that an estimated 500 million, or a fourth of the world's population who menstruate and are of reproductive age, don't have everything they need to manage menstruation. And this is a gross underestimation. We actually don't monitor or assess this at a global scale, or even in the United States, we don't have population level estimates. And so this impacts, those physical health outcomes, mental health outcomes, as well as psychosocial and well-being. So with that, I'll pause here, and I don't know if you have any questions or comments.
Yeah. So again, you've got a community of people watching this or will watch in the future that are interested in this work or potentially interested in it. How can we get involved with your research or with this work in general?
Yeah, so I put together just a few slides on this. I'm a very visual person, so I thought it might be helpful, and I made some resources for people. So I think there are kind of 3 ways to think about getting involved in this work. There's, of course, advocacy, and there are a lot of different policies that I mentioned and alluded to that people could consider supporting or proposing in their community. There is also thinking about access. So being part of different organizations or outreach that increases access to products in different spaces. And then there's just awareness. So in order to effectively and meaningfully engage in this work, we really need to start thinking about how we can eradicate period stigma. And that can be through hosting different sorts of workshops and and educational sessions, but also just having those small interpersonal conversations and being able to just think through how we can all be part of this conversation regardless of whether we menstruate or not. And I just want to highlight that Atlanta City Council is actually considering policy right now that would provide free products in city buildings. So if you're in the Atlanta metro area and are interested in engaging in this conversation, there is definitely a lot of potential for that. And then, of course, in the state of Georgia, we have so many different organizations that are working. Georgia Stomp is a group that I work with, and they host events all the time related to just being able to supply and pack products. They also host a lot of educational events and webinars. And then they also are key to Georgia's implementation of our policy to provide products in schools, working hand in hand with the Department of Education. And so those are, just a few ways to get involved, but really thinking about those three access points of advocacy, access, and awareness. So I think there's really an entree of options that you can get as engaged as possible, or as you want, basically.
So, and you kind of alluded to this just a second ago, but how big a role does stigma play in menstrual health?
Stigma plays a big role in menstrual health. So, there are really a lot of different examples of what that can look like. Starting at, the most, I think, interpersonal example is just in the ways that we talk about periods. There is a lot of language that kind of alludes to what to menstruation. So, things like ant flow or that time of the month. And so thinking about how we can just use direct, factual, health-based knowledge to be able to destigmatize menstruation is, step one. We also see, obviously, in what I was introducing at the beginning, there are financial and political stigma tied to menstruation, where products are taxed at rates that we don't see with other medically necessary devices or supplies. And so that is tied to stigma and, related to just historical inequities in how kind of the world has functioned historically. And we also see that in certain settings, people are kind of socialized to think that they shouldn't talk about periods, or they have to seclude themselves when they're on their periods. So all that to say, there's so many facets to this, and stigma, of course, is just at the crux of every single little piece of this topic.
And you mentioned this a little bit in your presentation, but we've seen countries like Scotland take the lead in providing free menstrual health items. So what positive policy outcomes would you recommend in the U.S., or have you seen enact in other states, or can you elaborate on what you've already discussed?
Yeah, so I think that starting to think about providing free products is a good starting point. And my work is in no way meant to be anti providing products. Instead, it's meant to be the exact opposite of that, of how can we effectively and meaningfully use the money that is being allocated to make this sustainable and impactful. And so I think these policies that are providing products is step one. And I think we need to really use our public health research resources and knowledge to just further improve these policies. So in order to effectively, mitigate period poverty, we need to make sure that we have access to bathrooms throughout different spaces. So at work, at home, in healthcare settings, at school, we need to make sure that we're able to dispose of products. So not only do we have products, but can we dispose of them in kind of healthful ways. We need to be able to have education. And that's a big thing in the US, especially about health education and needing to make sure that related to menstruation, that everyone is educated on what that means across different states. So I think that these policies that are uplifting the provision of products are a good starting place. And from there, we really need to start thinking about how we have comprehensive interventions that allow people to meaningfully and in a dignified way, really just manage their period. And I will say that this has been a historically and continues to be an underfunded area of research across the globe. Most of the research on menstrual health has been in low and middle income countries. And this conversation related to high income countries has really just begun in the last 7 to 10 years. We still don't know what works fully. And that's because there has been a lack of prioritization from funders and from people in power across the globe. And so as I think we get more resources and more attention, we'll be able to know what works better. But I think where we're at now is a good starting place. At least we're having the conversations.
Yeah. So tell me, what if you were to come across somebody who had never really thought about any of these issues or anything like that, and they were to push back a little bit about the idea of removing the tax on these products? So what would your argument, or what would you tell them would be the benefit for ending a tax on menstrual health products?
Yeah, so I would say that at least for example, in the state of Georgia, right, we have a 4% sales tax on menstrual products. We have also been operating on a surplus for many years, like at least for the last few years in our state government budget. And so we could afford to get rid of that sales tax, and we would be okay. Some of that money is going back to fund products in schools, but it would be, simpler and more equitable to actually remove the sales tax. There's been one study that I'm aware of that's really looked at, okay, if we remove the sales tax, what are the economic implications of that? The state still is functioning fine. It's just removing the sales tax of one product. And we do see that there are some benefits that actually are realized. So, for example, if we see that period products, for example, on average are $5, and a state has a 5% sales tax, that would make the products $5.25. So 25 cents more every time you buy a product, which adds up over time, right? And so being able to remove that for people, especially who are low income, will help them be able to afford different things that they need, as opposed to now people having to actually decide whether they can afford products or food. And so that's really kind of at the crux of this argument. And I'll just add that there's no comparable sort of item that is taxed for people who don't menstruate. And so from an equity standpoint, especially related to gender and sex, that is really, I guess, that key to that argument.
We're starting to run short on time, so we have gotten a couple questions from the audience, so I want to make sure we get to those. There have been a couple here there's two that are kind of the same question a little bit, but the first part is, what can you tell us about the Menstrual Equity for All Act? And then on that, can you speak more about the federal legislation? You mentioned nothing has been introduced, but I believe there are 3 bills during this Congress. So do you have any information on those acts? Or
the Menstrual Equity for All Act failed, to my knowledge. So it's not in discussion. I can't say much about it. It might have been reintroduced, and I'm just not sure of it at this point, but yeah, essentially we are trying to get some federal policies that kind of make it so that all states aren't taxing products and that we're kind of regulating the price to make it more equitable for people. But that is definitely a challenge. There is actually a comment. So there was opportunity for people to submit comments about the application of, for example, Title IX in schools that currently has Title IX as well as other sorts of federal policies have made it so kind of bathrooms, soap, water, toilet paper are they're givens in schools. And there has been discussion about how we get those policies to apply to period products. And so there was opportunity for public comments to be submitted about that. And some of my colleagues actually submitted comments and had positive reception to where now that is being discussed. And so that is, I think, a really promising path for us to go at more of a federal, national level. There are already policies that exist that should be applying to this. And we're seeing positive responses based on, advocacy happening.
Nice. And also, there was a question about, is there a location or a place where we can find your sources for your state information on policies and the map of state taxes? Do you have that information?
Yeah, so there are a number of different organizations that have this information available. Period.org has a lot of information. What is the other? Essentially, if you just Google, honestly, period policies in the US, there's period.org that has a lot of information about different states. They also have information of if you live in a certain area and you want to advocate for any of these policies, they have almost like it's like a one-page printout that has information relevant to that specific geographic area. The other organization is completely I cannot remember it right now, but it will pop up and they have other maps of different policies. There are some policies that aren't on there because, like I mentioned, this research hasn't been kind of comprehensively done, but period.org and just a Google search, I think, are good places to start. And there's a ton of information that's publicly available. Yeah.
Gotcha. Oh, and so we do have, so this is a two-for, so really quick on that. The Alliance for Period Supplies has maps for state policies.
That is the one.
Okay, excellent. And on that note, we have someone that is a member of the Alliance for Period Supplies who's on the webinar today, and they wanted to say that there's a 5th annual Period Poverty Awareness Week, May 20th through the 28th, and you can go to their website and get some more information there. So a great way to advocate from the start. Or after this conversation. So thank you all for sharing that information with us so we can share it here. So my final, we're really short on time. So I have just 2 more quick questions here. I'm curious as far as first, how did you get into this work? What inspired you? What led you here? And the second part of that is, are you positive? Are you a optimistic person or a pessimistic person about the future of menstrual health globally and domestically?
Yeah, so I got to this work through actually working with Georgia Stomp, that's here on the slide. I also, as you mentioned at the beginning of the webinar, do work with those who are experiencing houselessness. And so during the pandemic, a colleague and I started an outreach emergency supply chain that was focused on getting menstrual products as well as personal protective equipment, hygiene supplies to people who were experiencing houselessness, and started an organization that is a member organization with Georgia Stomp. And through that work, I learned more about what they're doing in public schools. And in collaboration with the Department of Education, and started trying to basically uplift the program that is happening in the state of Georgia, and be able to help the Department of Education make evidence-based and evidence-informed decisions. So in that, I first did some formative evaluation to determine whether period product dispensers should be added to the allowable list in the state. And our work showed that it should. So now public schools can not only use state funding to purchase products, but they can actually get different types of dispensers to have those products available to students throughout the state. And then currently we're doing work to look at the allocations that the state does, as well as just how the program functions and how we could kind of improve it across the state. And I would say, based on my work here and my work investigating policies, across the U.S., I feel optimistic. I think there is a lot that we are up against, and I'm not sure that I'm optimistic necessarily about repealing different policies that are perhaps resulting in some inequities, but I'm positive. I feel positive about our creativity and ability to meaningfully tackle this issue. And I think there's more and more momentum, and there are many researchers who are building our evidence base so that we can really make movement on this in the public health space, and also just the broader public space. So I'll leave it with I'm optimistic.
I like it, and we'll have to leave it there. And I do appreciate your time today, Dr. Ballard. And it's been I want to thank you all for attending today, and I especially want to thank you, Dr. Ballard, for participating in this really informative conversation. I think we all have learned a lot, and a lot of things to think about as a result of this today. So thank you for that. In closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master's of Public Health degree in 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health. The faculty and students conduct research on the complex public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, their residents, and community-based organizations committed to health equity. If you'd like more information about our programs and how to support the work of the school and our students, please visit publichealth.gsu.edu. Thank you again to Dr. Ballard, and thank you all for attending. This is the last Currents webinar of the spring semester, so please join us for the next webinar series this fall. We'll have some more information coming out about that later in the year, and we'll see you next time. Take care.